As an internist, I'm often in the position where I have to be the deliverer of bad news to patients. But in December of last year, I ended up being in the other chair as the patient when I was told that I basically heard those dreaded words, "You likely have cancer." And so then I basically had an experience that really has informed how I practice medicine and also the other work that I do in this Office of Healthcare Innovation and Quality. I mean, I'm a doctor, but I'm also a person, an individual. I have a family of 3 children, a husband, and when you hear such devastating news, what I felt, and I'm sure is common to most people, is start thinking about my mortality. I mean, what if I die? What if my quality of life is significantly impacted? What about my husband, my children? How will they be impacted? I mean, your mind just goes through all sorts of things. In addition to actually seeing patients, I work with state agencies and healthcare provider organizations to help improve the way we deliver care. So I basically was coming into this rather personal episode with that perspective. So I was looking for, well, what is the healthcare system like for me? I got to see the surgeon very quickly. The surgery was scheduled very swiftly. I needed to get this tumor out of me. There was good communication between my surgeon and myself, and primary care doctor, and the surgeon had set expectations about about the whole process and my recovery very well, so that I was reassured along the way that I was on track. On the other hand, what was missing for me was what we call behavioral health integration. And so a word about what I mean by behavioral health. I'm using that as a catch-all term that includes the care and treatment around mental health conditions such as anxiety or depression, also substance use disorders. We hear a lot these days about the opioid epidemic, and also the care and support that we provide patients to help them choose healthy behaviors that will produce better health outcomes, better quality of life. So as far as me, I am very lucky. And I'm also lucky that I received excellent care and my prognosis is good. And I'm very, very grateful for that. Wherever there's a challenge in life, there's always opportunity. And the opportunity here was for me to have this kind of lived experience that can better inform my work. So now when I am delivering bad news to patients, I'm actually in a practice that has recognized the value of behavioral health integration, and we now have a behavioralist who works side by side the primary care providers, and I can bring that behavioralist in and work as a team to be able to do a better job in delivering bad news and providing whole person care.